This episode of the podcast is brought to you by our friends at Regrow, the premier cloud-based cannabis supply chain management system.
Question for all the cannabis operators out there. Are your SOPs tied directly to your cultivation plans? Can you easily manage your inventory and workforce and vendors from a single system? Can you manage compliance across multiple licenses and states? If you said no to any of these questions, you need to stop what you're doing and talk to the team at Regrow. Compared to other software systems on the market, when you choose Regrow as a strategic business partner, you'll get all aspects of regulatory compliance built in, with the added value of workforce management, inventory, SOP management, and reporting and metrics that allow for companies to scale successfully. Regrow is the single pane of glass view into your entire supply chain, and the software will help you increase your revenue while keeping your entire operation fully compliant. Give them a call or visit their website at regrow.io. That's regrow.io. Regrow, the premier cloud-based cannabis supply chain management system. What's up again, my fellow people of the plant? In this episode of Cannabinoid Connect, I'm talking with Mara Gordon. Mara specializes in the development of cannabis treatment protocols for seriously ill patients and is a pioneer in the medicinal cannabis space. She is also the co-founder of Aunt Zelda's Zelira Therapeutics and OCTOPI Wellness, as well as a director of multiple organizations, including North Bay Credit Union. Her work is spotlighted in the award-winning documentaries Weed the People, Mary Jane's Women of Weed, and The Medicine in Marijuana. During our conversation, we discussed Mara's experience with medicinal cannabis, dealing with her own personal severe chronic pain. We talk about why she believes cannabis is medicine. We also discuss research findings around cannabinoid therapeutics and how you can prescribe cannabis effectively using data insights. So I hope you enjoy this episode as you watch or listen to my conversation with Mara Gordon, who's a cannabis entrepreneur and Tedx speaker. Hello, Mara. How are you?
I'm well. Thank you for asking, Kevin. How are you?
I am doing well. Thank you for asking me. How's Mexico, right? I mean, that's the new home. You just moved there.
Right. We were looking around at what was happening with our lifestyle in Northern California during COVID and the crazy prices and where they were going, and thought, well, this might be a good opportunity to bail and shift towards a more laid back lifestyle, and so we came down here. Love it.
Totally. Yeah. You and a lot of other people are doing that, right? I mean, I'm even hearing that some people or most people are moving back to smaller kind of rural areas where they grew up, so it seems like maybe this kind of moving out of the city or kind of the hustle and bustle, or even to different countries in your case. And
Right.
good for you. I mean, I'm a big firm believer that people should do what makes them happy, right? And as long as it doesn't harm or hurt anybody else, and that's great. So, Mara, I want to first kick this conversation off. You're obviously a well-known cannabis entrepreneur and several times a featured TEDx speaker, really speaking on the efficacy of cannabis as medicine, various cannabis treatment protocols that can treat people that have various ailments and whatnot. And so my first kind of question to kick this off is, why the passion? Is from my understanding, you do have experience utilizing cannabis yourself for your own personal ailment, which is severe chronic pain. So why don't you talk a little bit about that and this journey and what led you to where you are today and why you're so passionate about advocating for the plant?
That's a really good question. So I have to go back a few years. So in 1979, before half your listeners were born, my first husband had bone cancer. And there were no good options for him at all, treatment wise. It was just a matter of, let's just keep him as drugged up as we can until he dies. And so I went out seeking integrative and alternative medicine solutions at the time. And I took him to a Laetrile clinic and up in Ponca City, Oklahoma. And they had him on massive doses of vitamin C and macrobiotic diet and all these things at the time. And it was all under doctor supervision. It was all dosed and treated correctly. He still subsequently died, but he died without any pain medication, without any kind of, I mean, it was a much better death, is the way I look at it. And pretty well everyone in my family, except for me, thank God, has had cancer, and all except for one have died. One's still going through treatment. And I had no idea that cannabis was an option. If I'd known back then, of course, I would have utilized it, or at least approached it. I mean, I was going by, what was in the media at the time. Sure. So after I had bacterial spinal meningitis, and after I'd been better and had all these horrible health conditions, besides the pain, kidney and all sorts of other things, they had me on so many different pharmaceuticals that were just caustic and really hurting my health. And even more importantly, in some ways, they were destroying my quality of life. Mm-hmm. Because life isn't about longevity, it's about quality. Right. And I didn't have any. And so when I found out, very long story short, and people can hear it from in other places, when I found out that cannabis was in fact an option, and also for my husband, and I think it's important to always add that he's sober. And so he was looking for pain relief options that were not opioids, also and non-addictive, so they wouldn't, trigger the phenomenon of craving. And through a friend, I found out about cannabis and its possibilities. But then when I saw that it was ridiculous, absurd, what I was offered at a dispensary, the lack of guidance, the lack of quality.
What year was that?
2010.
Okay.
2010.
So even before the legal market, right? Because I think Colorado was legal in 2012. So this was purely medicinal in California.
Yeah, this was still under the Compassionate Use Act. Yeah. Okay. Completely. I mean, I had to go to a doctor and get a card, and the doctor's office had to be called to verify the legitimacy of the card. They didn't even have online verification services then. Right. So you had to hope that somebody was at the office to verify it while you were trying to buy. Sure. And they, I've talked about this so many times. I mean, they gave me a Rice Krispie treat, a brownie, and caramel corn. And on the Rice Krispie treat, which was just made like with saran wrap, it had a piece of masking tape on it that just said in black, like Sharpie, 5 to 20, but didn't say 5 to 20 what? Like, what does that mean? So, being a process engineer, I want details. I want every single detail. I want to know what it is, how I'm doing everything. And the person behind the counter said they had absolutely no idea. But this is what they recommended for people like that aren't smokers, stoners in those days, that kind of thing. And so when I got them home, I had bought a little moleskin, and I was keeping track. I was weighing each piece. I was keeping track of what I was using and what my husband was using, and onset and how it worked and how long it lasted and what the side effects, etc. There was nothing. It was like 20 ends of one. I mean, there was nothing to build on. So I just thought, I can't, if I'm going to try cannabis, I can't do this. I got to do it myself.
When you say there wasn't like any data out there at all, kind of that you could look to reference. Right. Did you also kind of see that there was a lot of disinformation or misinformation, or like, was that abundant? A lot of like the negative side effects of cannabis and those types?
No, I didn't really. I already had been part of the school that thought it was negative.
Okay.
That was where I came from.
So in that process, you kind of learned that was all, BS, yeah. I guess.
I thought that because I knew I had quite a few addicts in my life. They weren't cannabis addicts, but they were addicts or alcoholics or drug addicts. And all I knew is they all used cannabis. So I assume, or they had used cannabis or something, whatever my prejudice was. It was ridiculous. And I hope I've made amends for that at this
Of
point.
course. Yeah. No,
But,
yeah. That's what prohibition, the last 100 years of prohibition does, you know?
exactly, especially when you're the youngest and you grow up in a family where my older siblings were addicts. I was like, I wasn't going to be like them. I was the straight lace. I was the goody, two shoes. Well, not in a lot of ways, but I mean, as far as drugs and alcohol and things like that.
Right.
So I had horrible prejudice against it. So, but it wasn't what I was seeing for research wasn't all negative, but it was what I like to call magical thinking. It wasn't chemistry. It wasn't biology. It wasn't genetics. It was, the power of the goddess and the Gaia and the.
I see. More like holistic and of the earth type, I guess. I don't know what you would call it.
It was just the whole language around it was a big turnoff to me.
Right.
And I thought, if it's a turnoff to me, then how is a doctor ever going to feel comfortable recommending this for a patient? That's based in science, that wants data, that wants all these things. And starting with me, I wanted it. And so that was what started it all, was me searching for an understanding on how to dose myself and others consistently.
Outside of your example of like what you experienced at the dispensary when you were getting it and they didn't, there was a lack of knowledge, did you see that there was any type of understanding amongst the medical community, or really is that why you took it upon yourself to be like, hey, I'm going to learn more about this?
Such a good question. I immediately joined a well-known international cannabis clinician organization. And I started going to their meetings and I was just like, you have got to be kidding me. This is the best that we can do. It was like, I mean, now it's transformed, it's a lot better. But at the time, it was a bunch of what I like to refer to as, a bunch of doc in the box, practices where you go, you pay your $200, they give you a card. It wasn't practicing medicine.
Right.
And they were sending people for like ridiculous solutions that were just based on no science. Nothing was, if they even went that far.
Right.
So I was not impressed for what I was seeing in the medical community. And I wanted cannabis to be, if it's doing this for me, which was phenomenal. I mean, I had level 3 kidney disease because of the meningitis, and the drugs I had been on, gone, completely fixed my kidneys, got me out of a wheelchair, got me out of pain, did all these things. Then other people should have the right to have access, because chronic pain is one of the biggest problems we have for people missing work, people's lifestyles, people's quality of life, etc. So I was very determined that it would be something that a physician would mainstream in their toolbox, be able to recommend. So I started attending things like Patients at a Time, which used to be the only real medical conference out there. And it was like the gold standard for it. And it was like scientists and presenting the latest papers on preclinical research that was being done. And I just started eating up. Now I'm on their advisory board and I've spoken it, I think, 4 times at their events,
Wow.
which is kind of cool.
That's awesome.
Yeah, the first time they asked me, I was like, this is a monumentous moment. So
it's like
anyway.
Full circle, right? Yeah. Well, what I think is fascinating, and this is really what I want to get to and hear your thoughts on, is, the notion around cannabis is medicine, right? And you talked about how from back in 2010 until now, it's like completely changed, right? And you said, while back then there was a lack of understanding around genetics and biology and the science really of the efficacy of cannabis, we have that data now, right? And we're learning more and more, whether it be anecdotal or peer review studied. So why don't you tell us like why cannabis is medicine from a science perspective?
The reason that cannabis is medicine from looking at the basic chemistry of the plant and looking at the medicinal benefits. The human body has an endogenous cannabinoid system within it, called, we refer to it as the endocannabinoid system. In other words, internal. As part of that, we have cannabinoid receptors. There's, CB1 and CB2. The cannabinoid Cb1 receptors are primarily in the central nervous system, not exclusively, but primarily. And the CB2 are primarily in the immune system and peripheral organs. We know that the body creates endogenous cannabinoids. You have anandamide and 2-AG. It's found in breast milk. It's found in all mammals that have this endogenous system, and it works on quasi homeostasis within the body. There's also phytocannabinoids, which are plant-based cannabinoids, in addition to the endogenous ones of anandamide and 2-AG. And THC is a phytocannabinoid, CBD, CBG, CBN. There's hundreds of them now that have been identified. And some of them, primarily the THC, interacts and turns on, basically it's a key that unlocks the CB1 receptors and the CB2 receptors within the body, so that they activate them. So these are something that, which is why if you're treating a brain tumor, for example, there's a lot of CB1 receptors within the brain. You have something to target with the phytocannabinoids or the plant-based cannabinoids. We also know that there's so many of them. We also know, like, the terpenes within the plant. Many of them have their own medicinal benefit besides how you find them within cannabis. And so you also have this entourage effect, which is where I always like to say that the whole is greater than the sum of the parts with cannabis, for sure, where you have a greater impact and a greater efficacy, and also the ability to be able to take a therapeutic dose without as many negative side effects if you get the right combination.
What are we learning when you talk about the phytocannabinoids, right? THC being one that is well known. CBD is another. There's CBG, CBN. I hear there's over 150, if not more, phytocannabinoids that are out there, but we only know about a quarter of them.
Well, I think we know a lot more than that. We know, for one thing, you have the acidics, that have not been that still have the carboxyl molecule in place, like the THCA, like the CBDA. You have the virins, like the THCV, but then you have the virin acids, also the THCVA. So you have all of these different ones, and we actually have there actually has been quite a bit of research that's being done. You have people like, Didi Mieri in Israel at Technion. He's doing some interesting work looking at them. They've actually identified quite a lot of them that just right now just have a number next to them, instead of, been completely flushed out. But I think there's something like 180, 200 cannabinoids that have been identified. It's expensive to do research, I can tell you that. It's very expensive. And the other thing is, you have to promulgate plants and work with the genetics in such a way to have a significant enough amount of these to study them, because otherwise they're just a minor in conjunction with whatever the major cannabinoid is of that particular cultivar.
Yeah, I've heard that it's difficult to extract the rare phytocannabinoids because the amount in which they're in, that are included within the plant, they're not abundant, right? So
it also ends up being extremely expensive, because if you have to extract, if you think about all the, I saw a thing one time and it said all the platinum in the world would fit into a bathtub, and all their, or whatever it was, and all the gold in the world would fit into, 50 Olympic pools, or I'm making up numbers, but it was about that much of a difference. And it explains why platinum is so much more valuable because of the scarcity. So if you have to extract, 100 pounds of cannabis flowers to get, a few grams of a cannabinoid, that's not going to make as much sense as if you can do the whole thing. So, that's encouraging, obviously, things like biosynthetics and things like that, or even, yeast created cannabinoids.
Is it possible to like genetically modify the plant to where you really do have more of abundant amount of rare phytocannabinoids in that plant?
Well, I wouldn't give a blanket yes, but I would say in some cases. I mean, I know that medicinal genomics with Kevin McKiernan is doing some very interesting research and modifying it so that, like, all cannabinoids start out as CBGA. All right, it's the cannabigyral acid. It's kind of the mother compound within the plant. And what they've been working on is having the CBG not then convert over to THC, CBD. So they're working on changing the DNA of the plant so that it doesn't convert. Instead, it just develops more of the cannabigyral. Yeah.
Wow. And CBG, from what I've read, which is, like you said, it's basically like the mother, cannabinoid, right? Without CBG, you would not have CBD or THC. And from what I understand, like, there's a lot of different interesting health benefits. One in which that stood out to me was reducing cancer cell growth. Is that true?
A lot of the cannabinoids impact cell proliferation. CBG is one of them. I think CBG is very promising for brain disorders and for gut. Anybody that's having gut disorders. We've had some pretty interesting experience using it with people that have autism as an adjunct, because a lot of times there's also gut issues in that malady. A lot of people that have autism also have chronic abdominal issues and stomach digestive issues, and CBG is fantastic for that. Both gut, I mean, I always say the brain and then the second brain, which is the stomach. Yeah.
And when you say that, like, just like to get more specific, so like with the gut, is it more for like pain or like a good appetite kind of booster? And then in terms of like for the brain disorders, does it help kind of with memory or understanding or just stress alleviation? Like what in particular would CBG help with?
It works on the receptors, and it works on the inflammatory response. I am not a doctor, so I'm not going to give specific recommendations
Sure.
or guidance on anything. However, when you have digestive disorders, that works to help on digestive disorders in particular, not nausea itself. Nausea is a kind of, in most cases, is a side effect of something else, but it does seem to work on digestion. It also does seem to work on stopping the proliferation of cancer cells, because people have been utilizing it. And I know that there's companies, everyone's looking for their niche, that have been coming out with just CBG products. And they, I haven't seen any of these products in studies, but I have seen some studies on CBG itself.
Mm-hmm. Well, speaking of studies, that's a great segue, because I wanted to ask you if there are any, new research studies or findings around cannabinoid therapeutics that really stand out to you, or that have surprised you or fascinated you, or any way that are worth calling out.
I have to say, the thing I'm the most excited about is the studies that I'm seeing in terpenes. I unfortunately, so much of what I'm seeing developed in products is they're taking and they're distilling or isolating out the cannabinoids, they're taking out the terpenes, and they're adding them back in at an unnatural volume. And that is not a positive way to do it. However, the health benefits of, like, alpha-cumulene and beta caryophyllene in particular is one that activates the CB2 receptors. Yeah.
To pause you just so that I'm clear. So when you say that, like, that type of removal of the terpenes and then bringing them back in, that's like CO2 extraction, right?
You got it. You got it. You don't see me jumping on the CO2 bandwagon.
No,
Never have,
and
never will.
yeah, and that's not the first time that I haven't heard that. And it's worth talking about, right? Because I've had on Greg Autry, who's the founder of Sweet Sensei, and he's been in the game for 20 plus years, and he's a big proponent of, and this is where he has a lot of beef, is that when people use the word full plant extraction,
full spectrum,
he's like, well, it's not full spectrum if you're doing that process, if you're removing and then bringing, I mean, like, and he just talked about other examples of how it's not, and he's really true to kind of ensuring, that everything within the plant is kind of curated, it's high quality, and it's produced in a way that is most natural, right? So I get
we're in agreement. I mean, full spectrum is a marketing gimmick. The term full spectrum, they basically hijacked something that we talked about in whole plant extraction. And I can't figure out, I feel like if the Farm Bill hadn't passed, CO2 would have gone the way of, of the Etzel. But because CO2 is not the best way to extract. And people try to convince me, and I have friends that are in the CO2 equipment business, and they try to convince me, oh, we have these other processes, we do that, but it's like Frankenstein. If you pull something apart, you cannot put it back together the same. It just doesn't work. And what I consider good quality medicine is one where it has been extracted as gently as possible and in such a way that you are maintaining the profile of the plant as you go, and only filtering out things that you do not want to have in there, like chlorophylls and waxes and things like that. But you're maintaining the original profile. Some of the numbers are going to go down because some terpenes go down just by hitting the air. If you can smell it, it's gone. But we decarboxylate all of our oil and all of our medicines prior. And that's the way I recommend. Even when I do dabs every night before bed, I'm using pre-decarboxylated oil to do it because it just works better on treating diseases. I mean, the whole idea of having like a beautiful flower so that you can put a match to it, to me, is like in another world from talking about medicine. You know what I'm talking about, that bud porn stuff where, it's like, oh, isn't it pretty? Who cares? What's the chemical compound? What's in the plant?
Right.
So, the entourage effect, let me say, the entourage effect is still one of the most important points of this. And you do not have the entourage effect by pulling apart the terpenes from the cannabinoids and then putting them back together. They don't actually end up melding and having that same effect. We proved that out in a study that we did in 2018 that we published on breast cancer. And we, looking at the 3 major subtypes, we looked at single molecule of THC against real full spectrum whole plant medicine. And then we took the single molecule and added back in the top 5 terpenes in the same volume that they were within or same percentages that they were within the extract. And it didn't work any better than the single one at all. And the single molecule THC barely worked better than the placebo.
Okay. So there's a lot to unpack there, and I want to make sure that I get it clear, because we're on the same page as to what we're talking about with CO2 and how we want to preserve the terpenes in the best way possible. And in your view, CO2 by removing and putting back together is like Frankenstein, that example, right? It's just, it doesn't meld like great together and you're not preserving those terpenes. So here's my question. First off, I didn't expect you for a dabber at night. So that's pretty cool. I like that. But you talked about how you dab pre-carboxylated wax. Now I
No,
understand.
no, it's not.
No,
It's not
or
wax,
what is it?
and it's decarboxylated. I've actually removed the carboxyl molecule. It's in its active THC state already. Most of
Okay.
the products that are out there are THCA because they are not decarboxylated. When you buy
Right.
like a
They're
wax,
just
yeah,
flour that is ready to be burned, which is what decarboxylates it, which is what you inhale, which is what gets you
but
high.
also when you buy wax or shatter and all these things, they have not been decarboxylated, which means that you have to heat them up high
Right.
enough in
Right.
temperature to activate them.
So what you're saying is that is it just a pen that already like you just pull it and it's already heated to that level or what?
No, no. When we make our oils are delivered in syringes decarboxylated. We have already activated it within the syringe. So you could use it under your tongue without having to heat it, and it's going to be activated.
Oh, but
So
but it's a sublingual. It's not like something that you
extract.
smoke.
It's an extract.
It's an
Oh
extra.
yeah. You definitely can smoke it. I do dabs with it.
Okay, okay.
Yeah, I use
See,
the
I'm
dip.
from Texas, Mara.
So am
You gotta.
I. So am I
Okay.
originally. Yeah. So I don't. So it's, if you think about it in terms of, you would have to, when you are using like a wax or a shatter or something like that, and it's bright yellow or bright orange, and isn't it pretty? You have to heat your device so
Right,
high
right.
to activate it.
I just thought that that was no. I understand that. I thought that was normal. I didn't realize that you could get something that's already decarboxylized and you just use it right away. Like you
Got it.
don't have to. Yeah.
Exactly. You can keep the temperature very low. You can stick a little bit under your tongue. You can, anything you want. Yeah. And I've been
Yeah.
doing that every night for a decade.
That's crazy. Wow.
Yeah. And so I'm able to keep the temperature extremely low because I don't have to worry about activating it. I just have to vaporize it, that can be done at a pretty low temperature.
Right, right. Yeah. And you're preserving, again, the whole point is to preserve everything within the plant, the terpenes, the flavonoids, the cannabinoids. I mean, everything, right?
And when you decarboxylate it in the manufacturing process, you can do it low and slow, where you keep the temperature at a low level over time, to where you're able to preserve the profile of the actual medicine that you're making.
Huh. So how is it being in Mexico, like in the cannabis game? Is like, what's the culture like there?
Well, it's just getting started as far as the legal market, obviously. In fact, I've been asked to deliver a keynote address at an event in Cancun in November.
Ooh, that sounds horrible.
Yeah, it's awful, awful. But of course, I live off the beach in La Paz, so it's not like
uh,
I live in, in a hellhole somewhere. But
I was thinking like Mexico City or something maybe, but
no,
you're in the
I'm
beach.
down in Baja. I'm down in
Okay.
Baja. Yeah, Baja, California Sur. But it's interesting because uh, um, some people some people know who I am for whatever reason. They've just come across me. And so I was kind of surprised at how many people knew about my work here. They've either seen Weed the People, or they've been following my work for years, that kind of thing. Of course, unfortunately, they all assume that we're all millionaires or billionaires because we're in the cannabis business from California.
Right.
But yeah, we can talk about that. But I'm excited to be able to help them to roll it out better than what I've seen in the shit show that's the United States, and the way that it has piecemeal rolled out cannabis. So I feel like I'm here at the right time. I've got in the ear of some of the right people to be able to help to maybe guide some of that. So it's not just the big corporations that are, helping to roll it out for, in the pockets of the government. So I hope that we can do it better here.
Well, that's exciting that you have an opportunity to be instrumental in that process. And like you said, what better timing, because they did end up passing legalization, because I know that it was kind of on pause, right? But is it official now?
It is, but they haven't rolled out how it's going to happen. It's like it is, but how? Yeah, there is no structure in place yet. There's no idea of how it's going to be. It kind of reminds me a little bit of California in 2016 when Prop 64 passed. It was like, okay, great, now we have it. Now what? Now what happens? Does that mean I can walk down the street smoking a joint? I don't know. Does it? Does that mean I can buy it at 7-Eleven? I don't know. Does it? I mean, it's kind of like at that stage here.
Right. Like no one knows yet, but that's, again, the opportunity that's presented in front of you. And that's exciting to be part of, and
I'm a small part. I'd like to be bigger, but we'll see what happens.
Oh, I have faith that you'll play a bigger role. I have no doubt about that. Mara, I want to ask you one more question, and that is, the emergence of data in the last since at least the 2000s, with technology boom and whatnot, and how data is so important. So from your perspective, like, how can we utilize data to better prescribe cannabis medicine?
Okay, this question is going to sound like a setup, but it's not, because you asked me the best possible question you ever could have asked me, because I'm a data junkie. I mean, I'm a process engineer. I was part of the .com world and doing all that. I was the head of methodology and process engineering for Safeways worldwide before I stopped working in I call it the straight world, back years ago. That was 2003, I think. But I have developed a software platform that we've been utilizing internally since about 2012. And for the doctors who've been working with this and all the patients that have been coming to us, we've been collecting the data. We've been collecting about 300 data points coming in on each patient. And because we were able to control the medicine that they were getting, and being able to have the data with the COAs about the medicine, we were able to know what was working and what wasn't working. The upside to COVID has been that I stopped traveling every week somewhere, and I've just been heads down rebuilding our platform, and we're just putting it out there. And it's a platform for doctors to be able to make recommendations for their patients to be able to be part of the feedback loop, and for them to be able to start getting smarter and smarter with their recommendations based upon the feedback from the patients.
That is awesome. So this is targeted at what, adult use states or medical states, I guess, in the US, or do you have like a kind of where you operate now and you plan to expand later?
It is completely agnostic to my medicine. It has nothing to do with my medicine. Anywhere where people are accessing cannabis, it's available. In fact, I presented it to a group of 63 physicians in Brazil, a couple of weeks ago. And we've got some doctors all over that are starting to use it. As long it is better, obviously, and it depends upon the medicine that's being utilized having lab results. If there are no lab results, then we can't do a very good job of tracking it. Like, how do you know? It's just a guessing game what you're taking and what's in it. But as long as we have COAs of some sort that are hopefully accurate, then we're able to match it. So a physician, for example, let's say you come to us from Greece, and you have a patient that has a particular diagnosis. You look through the data, you make the determination that the patient needs, based upon these other ones, a good starting point is the therapeutic dose is going to be 20 milligrams per day of THC with beta caryophyllene and linalool and blah, blah, blah. The patient then is able to see what products are available in their area that will be able to be utilized in the way that the physician wants them to use it. And it'll only show them those products. So no more bait and switch of the physician tells you they want you to take a sublingual, you go to the dispensary and they sell you a pre-roll and a gummy bear. Those days are over for the medical side of things. So once the patient selects the medicine, it then generates instructions to the patient on how to use that particular product to achieve the physician's recommendation, and then gives feedback to the physician of what product the patient selected.
That is awesome. I really like that because, like you said, it's not all over the place and it's not like try this, try that, just kind of doing hodgepodge, kind of just, options in terms of formulations for products. And also, the feedback loop, right? The fact that the patient can, I would imagine there's, the feedback would also include things like how it's making me feel, it's working, it's not, so that you can kind of really pinpoint what particular terpene profile, cannabinoid ratio best work with that person's genetic system, right?
Exactly. It also measures things like almost every disease that I can think of has some sort of a scale that's for measuring. And so like if somebody comes to us that's an insomniac and they're only sleeping, 2 to 3 hours a night, and now they're sleeping 7 hours a night, that tells us something. If they're getting up after 4, but they're able to go to the bathroom, but they're able to go back to bed and fall right back asleep, that's very important information. They wake up feeling refreshed, that's important information that we're collecting. But we're also doing things like getting their scans and their lab work and any markers for what they're doing. So we're collecting all of that. So think of it in terms of if you go to a specialist, I mean, you're a young, healthy looking guy, but I can tell you that when you go to the doctor, especially a specialist of any kind, they give you a stack of papers to complete. They're always, like these Xeroxed, 13-page things where you have to all your health information. We've just gone ahead and digitized and automated all of that so that it's in a system that can be utilized to help other people, obviously all anonymized and HIPAA compliant. But it really is, it doesn't matter what the specialty is of the doctor, and it doesn't matter where the location is. It has more to do with whether they can access medicine that we know how many milligrams are in it. When we were just doing it in California, and we were just doing it with initially with our medicine, it was good, but we were small because we've always just been an R&D company. So we never we never even were in the dispensaries. We were just all about, direct controlling the data. And so patients would come to us with their medicines sometimes, and they would have lab results, but we came to an understanding very quickly that not all labs are the same. So we would have to be making corrections on the data based upon sometimes where they had the medicine tested. Some were more accurate than others. Yeah.
Right. I mean, there's probably a lot of variables that you're currently, going through as this entire industry is still in its infancy stage, really, right? Or in the first inning. So there's probably a lot of adjustments that you have to do and certain things as you're collecting this data. But I'll tell you, when this is all aggregated in 20, 30 plus years, I mean, this is going to be valuable stuff that, I'm sure that the pharmaceutical and healthcare system is going to want to take a look at when, it's federally legal, right?
Yeah, I'm already I can tell you 2 examples of it already that have been beneficial. First of all, Zelira Therapeutics, which was previously Zelda Therapeutics till it emerged with Zalira. I was one of the co-founders of that, and it's out of Australia. Now it's Australia, Philadelphia, it's in US. And we did a clinical trial in Australia because it's easier to do there. Their TGA isn't as rough as our FDA to get anything through as far as the process and the roadblocks. we did a study on a sleep formulation, and we were able to know with fairly good confidence level, high confidence level, that, and when I say confidence, I'm talking statistical confidence level, that it was going to be successful because of the experience we had in the data of all the patients that we'd been treating through Aunt Zelda's or with Aunt Zelda's all these years with this formulation. So when it came time to clinical trial it, it was less of a risk, and they're so expensive that it matters. And as a result, we've now come out with a product called Zenivol, which is a clinically trialed insomnia formulation or sleep formulation. So, which obviously is a different level than one that's just, made by mom and pop somewhere.
Right.
Yeah. So another thing is I've had quite a few insurance companies reach out to me because they already see the writing on the wall, and they're starting to see, especially in the workman's comp area, that it's cheaper to pay for people's cannabis than it is to pay for their opioids in many cases and get them back to work, or their anti-anxiety medicine, or whatever it is that's keeping them out of getting back to work and getting off of workman's comp.
Right. Wow. So, I mean, you were right. I did ask the right question. That was not pre-planned. So that was like perfect, because it sounds like you guys have got a lot going on right now, and it's exciting stuff.
Yeah, it's the name is OCTOPI Wellness, and it's called OCTOPI because I have at least 8 different end users for it. Everything from researchers, physicians, patients, even things like cultivators knowing what to grow because they know what medicines are being purchased on an ongoing, repeated basis. The difference between cannabis medicine and adult use, whatever that is on the medicine side, people don't want something new. They want the same thing over and over and over again with no surprises. So if you think about it from a grower standpoint, that you put GDP in the ground, and this harvest, next harvest, you're going to have this saying, you're going to have more and more people utilizing this to treat specific diseases, and they may get a 30, 60, 90-day refill on their medicine, just like they would a pharmaceutical. That's a much more low risk venture than trying for some new thing that doesn't go well.
Yeah, no, I could totally see that. And I totally hear your point about, like, on the pharmaceutical side, those medical patients, like you said, they want consistency, right? They want to know that something works, and they want to get that same thing every single time,
right,
and make it have the same effect. So that totally makes sense. Well,
okay,
Mara,
let me add one quick thing.
yeah, go ahead.
So the one big difference between the pharmaceutical, and I like to think that cannabis fits more into the nutraceutical or the biopharmaceutical, is really the space for it, biopharmaceutical. The one big difference is we don't want it to be exactly the same every month, every batch. We want it to have whatever the slight variance is in just when you're talking about something with 500 components in it, or manufacturing, there's going to be slight variances. Our experience has shown, and I need somebody to trial it. Our experience has shown that when you have slight variance utilizing like a biopharma, that people are able to stay at lower doses consistently over a very long period of time. And when they take the single molecule or the CO2 Frankenstein medicine, oftentimes they have to keep increasing to keep the efficacy.
Okay, so let's play that back, so we're clear for the audience and myself. So you're saying, say that again. I don't even want to try to repeat it.
What did I say? No, I'm kidding. When cannabis is like a biopharmaceutical.
What does that mean, biopharmaceutical?
That means a plant-based, not synthetic.
Okay, so totally natural, no chemically induced, no synthetics within it. It's
right
in its natural
also,
state.
right.
Like we talked about earlier, full plant, full spectrum, like to its really natural form, though, the right way.
Well, it might not be in its natural form from the standpoint that it may have been put through an ethanol extraction or olive oil infusion or something like that. But when you use it and you maintain the profile of the medicine for the most part,
Yes.
only removing the parts of it that are not necessary to the medicine, like chlorophyll and waxes and things, then you can keep the dose that's required for a particular ailment for whatever the target dose is. You're able to stay lower and consistent over time in a way that you're not if it's these other bastardized formulations. And we've got quite a bit of data on it, but definitely not enough to make any kind of medical claims, or of course we can't do that without FDA anyway. But it would be very, very good to have somebody do an agnostic study. In other words, not somebody who has skin in the game on a product line. I don't want anything that's funded by some big CO2 company, for example.
Yeah. Well, when those findings come out, so I'm with you. I understand. Thank you. Thank you for clarifying. And yeah, I mean, let me know. And whether it's you or like you and someone else that can speak to, like, let's talk about that, because that's very interesting. And that'll only reinforce what we're talking about when it comes to, how you mentioned like the mismarketing of like full spectrum products, right? And really what that means.
Right. Yeah, full spectrum versus broad spectrum. That's another one that you see all the time. And it's like, what? Yeah, it's like natural. Like, what does natural mean?
Right. Yeah.
It's organic. Yeah.
Totally. Well, Mara, before we wrap up, is there anything else that's top of mind for you that you want to share with the audience?
Oh gosh, I tell you, one of the things that's really exciting is I gave a presentation on, I think it was Monday, to a group in West Africa. I'm doing one on Friday morning for the Ukraine. It's like unbelievable where the momentum around the world is getting. I had somebody reach out to me recently from Siberia.
Wow.
It's like, I mean, this little thing that, that Dennis Perone and Brownie Mary started in California, and for the AIDS patients, has grown into a worldwide phenomenon. And I think that, any government officials, they better get the hell out of the way if they're standing in the way, because this is happening.
Yeah, no, I totally agree. I mean, I'm seeing it just like you said, that momentum is continuing to build. More people worldwide are kind of curious and seeing it as a better alternative, right? To compared to what we've been used to or what we've been told in the past.
Yeah.
So
and it's chemistry. It's chemistry. It's not magic. It's chemistry. We can explain what's happening and why it happens. It's fantastic that there's this plant out there that does all these things, but it's not magic. It's explainable. And that's what gives it the gravitas and the credibility that it really needs to be accepted.
Totally. Yeah. And voices like yours really help kind of explain the science and all the data driven kind of insights behind it. And, but when we start to talk about cannabis or hemp, as it relates to, creating material goods, at that point, it sounds a little magical, and that's a whole different conversation. But, the plant is amazing, and there is science backed data to support its efficacy, and you've shared that today, Mara. So really appreciate your time. Where can people find you on social media? Your companies that you mentioned, their website, social media links to learn more.
So my personal Twitter account is the one that I use all the time. I'm not real big on anyway, so it's at Mara BG is the one I use the most on Twitter. I have, of course, Aunt Zelda's at Aunt Zelda's. And if you write, I'll respond. On LinkedIn, it's Mara Gordon. Website, auntzeldas.org. And OCTOPI Wellness right now is more for the physician side of things. But so if you have physicians that are listening, I would like them to sign up, and we'll get them onboarded as quickly as possible. And Gosh, that's really about it. I think if that's not enough, then you're not trying to find me.
Awesome. Well, and we'll be sure to include those links in the description box on our YouTube video as well. So,
Right.
Mara, thank you so much again for your time. Really enjoyed the conversation. Want to have you back again real soon as you start to learn more and this industry progresses.
Absolutely. My pleasure, Kevin. Take care of yourself.
Yes. And thank you all for listening. Bye.